do you have a message that you want to share with everybody?
Jewish Family Services and what they're doing here in the greater Hartford area is fantastic. We need to break the cultural stigma that treats these illnesses as moral failings rather than medical failings. No one gets up any given day and tries to lose their job, make enemies with their friends and family, and try to get arrested. That's not what the normal human being does. So this is not a voluntary choice that people make. These are diseases that run through my family, as they do many other families, and I am very much wanting to break the cycle so that my kids have less of a exposure to this illness and that they themselves will be less prone to succumbing to this illness because they won't see it modeled in their lives.
Mental health is something that we as a culture do not talk enough about, and the statistics keep getting worse. And I love that Jewish Family Services comes together to bring people together to tell their stories to end the stigma on mental illness.
Well, we're here with 600 people. Have you seen a change over the past few years? Do you see it being less stigmatized?
Well, I definitely think that it's talked about more, which is really good. And events like this that bring people together, bring thought leaders, bring people that have struggled with it themselves to tell their stories helps to end the stigma.
Is there one bit of advice that you'd like to share with the community?
Share your stories. Talk to your children. I think almost everybody has been affected in some way by mental illness, but for some reason the conversations are still taboo. And when you think about it, if somebody was affected with cancer, you wouldn't not talk about it. So talk to your kids about mental illness. Talk to your friends about it. Spread the word. It's okay to have conversations.
So, Patrick, do you have a message that you want to share with everybody?
Yes, stop the segregation of mental health to something other than healthcare, because mental health is part of healthcare. And yet most people feel stigmatized because they don't see it as part of the normal course of getting a checkup. So I'm going to be advocating for a checkup from the neck up.
Understand that for those who struggle with mental illness day by day, it is a painful journey as they encounter peaks and valleys.
Ketamine has been used as an anesthetic. What they've discovered is that in low doses, it can help people with depression, and it can help very rapidly.
How has your story changed from last year to this year?
I unfortunately got much more ill after last May's event and had a very difficult summer that involved hospitalization and more treatments. But I have been extremely lucky since August that I am now really just dealing with a mild depression, and I haven't been in this situation in 5 years.